Hello friends, welcome to our channel of Studio Homeopathy, and I am Dr. Ravi Doctor. Today I'm going to present to you a speech session on clinical medicine and its materia medica, and the topic is migraine, the only disease which is physically and psychologically very devastating for the patient. So before we understand migraine, let's understand the most common causes for headache. To begin, the first is ophthalmic. Second are the sinuses, which gets involved, usually associated with respiratory conditions. Earaches, very common even in pediatric cases where the child is continuously crying. Earaches can be very troublesome for the child. Dental, associated with dental caries. Neurological as well as cardiovascular and especially blood pressure becomes one of the most leading causes. But migraine is a very chronic headache condition which is commonly seen in a lot of people. According to the World Health Organization, it is about the third most common disease in the world, and about 30% of the population of the world suffers from migraine. Age 18 to 65. Now, to understand the pathophysiology of migraine, to begin with, the first pathophysiology, what happens is due to certain neurotransmitters, due to electrical changes of the nerves, what happens is there is a vasospasm which happens in the cerebral blood vessels. Now, as a result of which, what happens when the vasospasm happens, this is seen clinically as a dizziness. It can be seen as visual disturbances where the patient again has an aura and associated with nausea, vomiting. On the other hand, what happens is post vasospasm, it leads to vasodilatation. As soon as dilatation happens, but natural, the blood flow increases, there is throbbing of the carotids and suddenly flushing of the face, and this is a very typical migrainous headache where there is throbbing of one-sided of headache. So you can see this beautiful photograph here where the patient is actually clogging one side of the head, and this can be very severe type of a pain. So coming up to homeopathic therapeutics, the first what I would always see in my clinical practice is when the patient comes and the patient says, "Doctor, I feel my head is throbbing. I feel every blood vessel is throbbing. मुझे ऐसे लगता है कि सब मेरी पूरा brain ऐसा throb कर रहा है." And that is the time when you see the patient flushed face, flushed eyes, belladonna. On the second most important remedy, the patient comes to your clinic bursting type of headache, but here the patient has come tying something to the head, and the patient says, "Doctor साहब, मैं अगर आँखें भी move करता हूँ तो भी मेरे को बहुत दर्द होता है." Bryonia. So please remember, in bryonia, the thirst and the change of temperatures are again very important. Patient has gone out shopping, patient has come back home, and post shopping or post noon sun, like a sunstroke kind of a headache, and the patient has again developed a very severe headache. Please think of glonoin. In women, especially menstrual, when associated with menses, so whenever the menses are a bit delayed, and that's a time when women complain of a lot of pain which is coming up on the head, especially before menstrual cycles, and feeling better with epistaxis or the beginning of menses, very excruciating headaches, please think about Lotus. But one of my favorite, you've gone shopping, you've come back, once you start resting and then the pain comes, so severe bursting pains with blur eyes and better with vomiting but aggravated rest. The only remedy is iris versicolor. Now these are my leading remedies, but doctors, please rule out cerebral and cardiovascular pathologies, especially whenever you're dealing with such kind of chronic headaches. Now moving on, for the patients, please tell them to avoid chocolates, colas, direct noon sun, fasting, especially in season time or whenever there is festival season, especially patients go on to fasting. It can trigger a migraine. Strong lights, a loud noise, and stress, of course, with sleep deprivation can be important triggering factors for migraine. Again, this requires to be checked. So if our viewers, please do not self-medicate yourself. Please contact your doctors, and in the end, a constitutional remedy is going to be one of the best choice. But acute remedies, you can use what I have just said. Migraine can be prevented, migraine can be treated. Live, learn, love homeopathy. Keep watching, keep subscribing, and best wishes of the season from all of us. Bye.